everyone, my name is Hope Stocker. I am the Heart Failure Program Coordinator. The Heart Failure Program consists of doctors, nurses, pharmacy, nutrition, palliative care, case managers, and outpatient clinics. Today we're presenting this video to give you some updates from the Heart Failure Program. Heart failure is a chronic progressive condition. Many times patients with heart failure do not realize their symptoms are related to their heart failure. I think it's important to have this conversation with patients because if they knew that maybe they could slow the progression of their heart failure, they may be more likely to follow recommendations for heart failure guidelines. Let's take a look at the Heart Failure book, which has recently been updated. You'll notice that there's now a red logo instead of a blue logo. On page 2 is a picture of common symptoms patients experience with heart failure. I think it's very important to point this out to patients. That way they know what symptoms to look for when they go home. Page 1 is the daily stoplight tool for heart failure. The green zone means the symptoms are under control and that they're doing everything they should be doing to try to keep their symptoms under control. The yellow zone means symptoms may be returning and they should call the cardiologist's office to try to intervene before they have an emergency. The red zone is when they should be calling 911. In the very back of the book, on the inside cover, is a symptom chart, a spot where they can write their weights down each day, and then a spot over to the side where they can write down their symptoms that they're having each day. Many of the medications will be adjusted based off of the patient's symptoms, and it's important to keep record of that. On the very back cover is a discharge checklist. That way, as you work with your patients, you can check off certain education topics that you guys have already talked about. The typical heart failure patient is often forgetful and needs education reinforcement. There's a lot of job aids online that can help assist you as you're working with your patients. Let's take a peek at that now. The first thing you will do is click on Departments, then click on Nursing. Then click on the green box labeled Nursing Education. Then click on Nursing Job Aids. Then click to expand Heart Failure, located in the middle of the page. Here you will find certain resources such as an electronic copy of the Heart Failure Guide, symptom chart, smart phrases, and the stoplight tool. The last thing I want to tell you about is that we've recently started a heart failure support group located in the basement floor of the MOB building. It's the fourth Thursday of every month at 1 p.m. We also have a heart failure class that's connected with cardiac rehab and have opened heart failure clinics with the Everett Clinic, Western Washington Cardiology, and PMG. I would really like to thank you guys for all your hard work. We really have reduced readmissions and increased patient satisfaction. Thank you very much.